Welcome to Illuminations. I'm Ranae Moran, and I'm here with my co-host, Phillips, joined by two gentlemen, Dr. Bruce Greyson and Dr. Gary Habermas, who are considered to be experts on the subject of near-death experiences, including the scientific and spiritual aspects of the experiences. Dr. Bruce Greyson is the Chester Carlson Professor Emeritus of Psychiatry and Neurobehavioral Sciences at the University of Virginia. He has earned awards for his medical research and was elected a Distinguished Life Fellow of the American Psychiatric Association, the highest honor bestowed by that organization. He has spent more than 45 years scientifically studying near-death experiences.
Dr. Gary Habermas is the Distinguished Research Professor of Apologetics and Philosophy at Liberty University School of Divinity. He's considered a leading expert on the history of the resurrection of Jesus, and additionally, he has written over 43 books, including Beyond Death, Exploring the Evidence for Immortality. So, Bruce, can you get us started by telling us exactly how you would define a near-death experience?
Sure. First, let me say I'm so glad to be with you and Ranae today, and to be with my friend Gary again.
Thank you, Bruce.
So a near-death experience is essentially a profound subjective experience that many people have on the threshold of death. That is, when they're in a near-death situation or when they're actually pronounced dead. And it typically includes such mystical elements as leaving the physical body, entering some apparently unearthly realm of existence that's confused with light. They often see deceased loved ones and entities that they regard as deities. And they sometimes may go through a life review. Their whole life flashes before them. And at some point, they may make a decision to return to their bodies, or they are sent back against their will. And for me as a psychiatrist, one of the most profound parts of the experience is not the experience itself, but the way it changes people's lives thereafter.
Bruce, what do scientists have to say about consciousness and how it works with the brain?
Well, that's an interesting question, Ranae, because we've always assumed that the mind is what the brain does, that consciousness comes from the brain. And experiences like near-death experiences, in which thinking and perceiving seem to be more vivid than ever, that occur while the brain is at least seriously impaired, if not completely shut down, call that into question.
Gary, you've talked about in the past about how the death of your grandmother had a big influence on your interest in the afterlife. Can you tell us about that?
Sure, and I'll I'll follow Bruce in saying hi to my my good buddy there, and Renee and Deanne. Good to be with all of you. Yeah, when I was a child, if Elizabeth Kubler-Ross can be taken on this point, she used to argue that our most profound views of death usually happen between the ages of 8 and 11. And precisely when I was 8 years old, my great grandmother died. She was the closest person in the world to me. We might think of great grandmothers as removed, but she was closer. I had a very close-knit family, but she was closer to me than anybody else in the world. And when she died, it was a huge stress on me at the time. And some years after that, I often think it went back to that occasion, which sparked my interest in the near-death experiences in general and the resurrection of Jesus in particular.
Bruce, how did you first become interested in near-death experiences?
Well, I was raised in a non-religious household. My father was a scientist, and I was raised to believe that the physical world was all there is, that what you see is what you get. It's not that my family was anti-religious, it just never came up in our household. So I went through college and medical school with the idea that the material world was all that there was. And then shortly after I started my psychiatric training, just a couple months out of medical school, I was called to evaluate a patient in the emergency room who had overdosed, and she was totally unconscious. I could not talk with her. But her roommate, who had brought her in, was waiting for me in another part of the hospital. And I went down there to talk with her and get information about the patient. I then came back to see the patient. She was still unconscious, and she was being admitted to the intensive care unit overnight. And I managed to see her the following morning. She was barely awake. She was very drowsy. I introduced myself, and she startled me by saying, "I know who you are. I remember you from last night." So I said, "Well, I thought you were unconscious. I didn't know you could see me." And then she opened her eyes for the first time and said, "Not in my room. I saw you talking to my roommate." Well, that just blew my mind. I didn't know what she was talking about. The only way I could imagine that happening is if she had left her body and followed me down to her roommate's room. And that just made no sense to me. As far as I could tell, I was my body. So I kind of challenged her on this. And she said, then she went on to tell me about the conversation I had with her roommate, everything we said, where we were sitting, what we were wearing, making no mistakes at all. I just couldn't understand this at all. So I kind of tried to push it out of my mind for a while because I just couldn't understand it. And a few years later, I met Dr. Raymond Moody and read his book, Life After Life, which gave us the name for these phenomena, near-death experiences, and told us what happens during a near-death experience. And I realized for the first time that this was not just one bizarre thing that happened to one patient of mine, but it was a common experience. And since I couldn't understand it, couldn't explain it, that I realized I have to take this seriously.
So you thought it was just kind of a one-off thing initially, and you were hesitant to tell anyone, or?
Well, yeah, I didn't tell anyone. They think I was crazy. I can imagine how the patient felt talking about it. So I tried to push it out of my mind very unsuccessfully until I realized this is something really that we need to confront. It really challenges everything we thought we knew about the mind and the brain and about what makes people people.
How long was it before you found out that there were other experiences like that?
Well, it was about 4 or 5 years before I read Moody's book and realized there were many of these. Now, in that interim, I had talked to other patients who described similar things, and I tried to dismiss them as being part of their mental illness.
So, well, Gary, would you classify these as miracles?
I personally would not would qualify them that way. A miracle traditionally, even defined most influentially a couple centuries ago by the skeptical philosopher David Hume, is an event that he said breaks the laws of nature brought about by God or some invisible agent. Well, he didn't believe in God or invisible agents, so he just said that's what a miracle would be if it happened. But if you use that kind of definition, I don't think miracles break the laws of nature. I don't think they have to be performed by God. I think it could be in a world where God exists. But I don't think, I think of near-death experiences as religious phenomena at their best, which bring considerations concerning not even an afterlife per se, but what I would say is minimal consciousness after the initial, as Bruce just described, what might be the first few stages or minutes or hours after somebody's death, especially in cases of as far as is known medically, inactivity from either the heart or the brain, which are just seconds apart. So I think it's kind of a pretty normal circumstance that's going to involve some other factors, religious factors. But I don't think it's like God coming down on people or pronouncing one religion true over another religion or that sort of thing. In other words, theologians often differentiate between what can be gathered from the natural order and what can be gathered from specific data. I would put near-death experiences in sort of a natural, broad category of what we might expect about life in general.
I
So,
see.
Dr. Habermas, I wanted to follow up on that a bit. So, based on what you just said, are you saying that you think consciousness might only last a short while after death, or do you think there's an afterlife?
Well, I think there's an afterlife, but I think if you're going to say, let's try to evidence him with near-death experiences, I think the issue is that the vast majority of near-death experiences are not evidenced. Of those that have been, the sort of thing that Bruce just started with is an amazing case where this young lady could talk about what was going on a ways away from her and give a very accurate description. That kind of expands your ideas of what the world is like. So now, if she were in a state where she had a cardiac arrest with ventricular fibrillation and had no measurable heart sense, I mean, it's a cardiac arrest, about 15 to 30 seconds later, the brain waves disappear. Dr. Greyson could respond to that very well. But so what I'm saying is, at the most, people who, first of all, evidential cases are more rare for sure than general NDEs. Secondly, once you get those evidential cases, they generally don't last a real long time. Sometimes they're surprisingly long. In fact, Dr. Greyson himself has done an excellent article years ago on what are historically referred to as Picandarian cases, where near-death persons claim to have met a family member or a close friend that gives information that maybe nobody knows, at least nobody in the thereabouts know. No friends, nobody in the waiting room, nobody in the family, and they report data that can be verified. Then you start thinking, well, if that happened, how long's that person been dead? And there are cases anywhere from 1 to, I mean, I remember a case of 49 years, of cases at 10 years. So no matter where you go, even if you give that the best, most likely, your best shot at an explanation for afterlife, you can't use near-death experiences, in my view, to argue for eternal life or what might go on beyond that. I think that's probably where religious data are going to come in, and why I got interested in the resurrection of Jesus, which I think the corollaries for that event puts other things in the equation here. But NDEs alone, very influential, evidential, and evidential for, as I said, minimal consciousness beyond a near-death state, and in a flat brain, flat heart, measurable state, what the machines say. That's shorter, but it's very suggestive.
Thank you for explaining that for me.
So I would like to ask both of you, how many near-death experiences have you studied or collected or whatever? Or do you even know?
Well, I include in my research database slightly more than 1,000. Those are the cases for which I have sufficient information about the phenomenology and about the medical details of the near-death event. I've spoken to many more people who I don't include in my research because I don't have enough information about them.
Yeah, in my case, I don't do the kind of investigation that Bruce does, because he's got the unique, not just medical training, but psychiatric and brain science training. I would say hundreds in my case, but most of mine come from listening to stories and then zeroing in when somebody, like, for example, if I had heard that case that Bruce described about the woman giving an account of her friends a distance away from her, when she said, "Oh no, not here in the room with me, I watched you go down the hallway," I would have zeroed in on that, and then I would, as I'm doing right now, because one of my best friends just had a near-death experience. And the guy's got a PhD. He's in philosophy. He's very sharp, and he just wrote to me yesterday to tell me this. And we're exchanging emails. That's kind of what I would do. I would interview him right away and say, "Anything in the room? Are you aware of conversations? How about a distance away?" And if, again, to go back to Bruce's, if somebody said, "Oh no, this was down the hall, I saw something," they're more rare, but there are a lot of them. And the data stack up very nicely. And when they stack up with an apparent, according to the machines, less evidence of heart or brain working, now they become more and more evidential, but usually only for short periods of time.
Bruce, in your new book, After, you chronicle a lot of the stories of the people who have had near-death experiences, as well as some of your research. And once you started researching these near-death experiences, you felt they were important enough that you co-founded the International Association for Near-Death Studies.
Yes.
Tell us about that organization.
Well, this was back in around 1980. After Modi wrote his book in 1975, he was contacted by several doctors and psychologists and cardiologists who were interested in studying this phenomenon. So he wisely brought them all together to talk about how to do that, how to research these phenomena. And out of that group came the International Association for Near-Death Studies in 1980. And it was originally started to support researchers and to bring some consistency to how we went about studying the phenomenon. And it quickly became apparent that as great as our need was, there was a much greater need to provide support to the experiencers themselves who were having trouble understanding the experience and integrating it into their lives. And now, 40 years later, the organization is a worldwide collection of doctors, researchers, people who've had near-death experiences, their families and friends, people interested in death and dying. It holds annual conferences. It has a scholarly journal and a quarterly newsletter, and provides all sorts of educational materials for experiencers and for other people.
Is it difficult to apply the scientific method to studying NDEs?
Well, it's hard because they don't happen in a predictable way. You can't set up an experiment and then have it happen. They happen spontaneously. So for example, when we want to know about what's going on in the brain during an NDE or near-death experience, but you can't slap on electrodes, which take about a half an hour to an hour to put on when someone is in a cardiac arrest and they're being resuscitated. So it's hard to get that type of documentation about near-death experiences. We're also dealing primarily with a subjective experience. So you have to rely on what people tell us. We can't go into their minds and know firsthand what they experienced. So to correct for our personal biases or cultural biases, we have to collect many, many experiences, hundreds and thousands, and look for the patterns that have consistency.
Gary, you're a historian extraordinaire. So my understanding is there is a multitude of near-death experiences that are accounts from the ancient Greek and Greek and Roman people. Can you tell us about that?
Yeah, there are a number of sources pre-Christian. For example, Plato's Republic, in that famous work by a famous philosopher, he has a story called The Myth of and that story is about going out to take care of bodies after a battle. And one of the persons thought to be dead was resuscitated, I assume spontaneously. And when the person came to, they said that they had visited both hell and heaven, or what generally would be described as a hellish experience and a heavenly experience at the same time. So that was written up by Plato, and again, it's called The Myth of So he probably thought, yeah, nice story, that kind of thing. But we find them in the ancient Roman world. They're mentioned often. Raymond Moody, in his very first book that Bruce has already referred to, Life After Life, and many other writers have even talked about these cases in the Bible. And, so yeah, they seem to have been known for a long time. And the more we find out about them, the more of these things turn up. So they're very common. And again, whether they're just totally subjective, they are almost extremely influential to the person who had them, no matter what state they're in, no matter whether there's evidence or no evidence. I mean, I remember a philosopher in a major journal saying years ago, he said, well, I don't know how much this is evidence for an afterlife. He said, but I'll tell you one thing. If you were the one who had the experience, you would be justified in claiming that that's what you saw. So for you, at least, it's very, very special. And I think that's largely the case. It's very, very special for the NDEers themselves.
So Bruce, that account of that ancient account was pretty different. I mean, is it common for people to visit both heaven and hell?
It's not common, but it does happen. Nowadays, when we hear people who have frightening experiences, they often report going to a hellish-like environment and then at some point being rescued and taken to a heavenly environment. So it does happen these days. But there are many other accounts from the ancient world that includes things that are more typical of what we hear today from near-death experiences.
So is there kind of a general model for modern day NDEs?
There's a model for what people experience, but not how they talk about it. Most people who have a near-death experience start off their account by saying, well, there aren't really words to describe this, or I can't put it into your words. And then we get excited and say, well, tell me about it. So we're sort of forcing them to distort the experience by putting it into words for us. So they use whatever metaphors they have available to them to describe what happened. And those are often religious metaphors or cultural metaphors. So for example, people all over the world will meet a warm, loving being of light that radiates acceptance and sense of well-being. And if you're talking to a Christian here in the US, they're likely to say that was God or that was Christ. Whereas if you're talking to a Hindu in South Asia, they're not going to use those words. They may call it a Yamdut or a deceased loved one or something like that. Or many people just say it was a being of light. And in fact, I've talked to many people here who say, I'm going to call it God, so you know what I'm talking about. I can't think of another word for it, but it's not the God I was taught about in church. It's much bigger than that. And they talk about all parts of the near-death experience in metaphoric terms. Another example is the tunnel. Most people describe going through a long, dark, enclosed space to get from this physical world where the body is to the other realm, where most of the action of the NDE takes place. And here in the US, they say, I went through this tunnel to a realm of light. But if you talk to people who have their NDEs in cultures where there aren't a lot of structures like tunnels, they may say, I went into a cave, or I fell into a well, or I got sucked into the calyx of a flower. So they use what metaphors they have. I talked to one fellow here who was a truck driver who said, then I got sucked into this long tailpipe. So use whatever words you have available to describe this ineffable thing.
Is light always an element pretty much in all of them?
It usually is. Now, there are many near-death experiences that involve leaving the body and watching what's going on around the body, and not much more than that. But those people who actually go to some apparently other realm often describe it as a realm of light, a being of light. Now, there are some people who have an experience of being in a realm of utter darkness. And for Americans and Westerners in general, that's often a terrifying experience. They describe being in this featureless void with no sight, no sound, nothing but their own consciousness and nothing else for eternity, which is terribly lonely for us. But I've also talked to people who were raised in the Hindu culture who describe the same thing and described it as blissful. They say, this was nirvana. So again, it's your culture helps you determine how you interpret the experience, but the experience itself is the same across the globe.
Bruce, there is an account by a professor who taught Albert Einstein, and it's been speculated that perhaps that incident affected Einstein's theory of relativity. How did people come to that speculation?
Well, this is an interesting story because it goes back to Albert von St. Gallen Heim, who was a geology professor at the Zurich Technological Institute. And he was an amateur mountain climber in the Alps. And when he was in his 20s, he fell when he was climbing a mountain and fell several hundred feet, repeatedly crashing against the craggy rocks as he fell. And he wrote that time seemed to slow down for him so that he was able to think very carefully and calmly how to twist around so you end up landing in a snowdrift rather than in the rocks. And he said the most impressive thing was that it was a blissful experience. He wrote, I have watched people fall before, and it's terrifying to watch someone fall. But when I was falling, it was wonderful. It was blissful. He reviewed his whole life, and it took like 6 seconds for him to fall. And it took him hours to report what happened to him. He was so impressed by this that he started asking other mountain climbers and quickly collected 30 other cases that he published in the yearbook of the Swiss Alpine Club in 1892. He also was so impressed that he started talking to all his geology students at Zurich about this experience. And 10, 15 years later, one of his students was a teenage Albert Einstein, who heard Heim saying that as I fell, as I was going faster and faster, time expanded and became greater and greater. And sure enough, about 10 years later, Einstein writes his theory of relativity, which says that the faster you go, the more time expands.
This slowing of time or expanding of time is a common element of an NDE, isn't it?
Many near-death experiencers say that the sense of time that we have in this earthly life does not exist in the other realm. They may say it's distorted. It's as if everything happens at once, or as if everything takes place in eternity. And many say, frankly, there is no such thing as time. That's just something we impose on it. So, Gary was talking before about how long consciousness could last after the body dies. Is it just a matter of minutes, or can it go on for a long time? And if you ask near-death experiencers that question, they will say, that doesn't make sense because there's no time after you die.
Gary, of the common elements typically found in near-death experiences, which ones point the most to evidence of an afterlife from a spiritual aspect?
Well, I would say evidentially there's two broad categories that might be entertained there. One is that now Bruce has very nicely separated the NDE reports that happen in this world and those that happen after a person experiences being snatched away to another realm or traveling. Sometimes they just are there in that realm. Sometimes they have something here. They see something here and then they go there. That's the tunnel. To me, the most evidential ones, virtually all the evidential ones, are descriptions of things that happen in this world. And near-death researchers frequently differentiate between evidence inside the room, evidence outside the room. That would be like the case of the woman in the coma watching a presumed conversation from down the hall, or it could be a mile away, it could be further away. But when they get whisked away to another realm, the evidence is of the sorts we've been explaining are virtually non-existent. I would say, with the exception of mostly with the cases that I referred to, one of the articles that Bruce has he has more than a couple dozen Picandarian cases. If somebody meets somebody that they are sure they knew who they were, let's say their father, their wife, husband, and that person reports evidence of something that's happened that can be checked out. But again, we're back to the real world, because if the person says XYZ is going to happen, if you can't verify it, you're going to say, oh, that's a nice story. I'm glad you were influenced. If you can check it out, then that becomes more of an evidential tale. But this objective, subjective, most of them are subjective reports because there's not much to hang your hat on. The ones that are kind of catch people's attention because they're amazing. And I'll say one thing about the subjective thing. It's amazing when you talk to NDEers, they often very quickly get to a state where they'll say something like, well, I was in this other realm and how should I say this? They'll say, the colors are just, well, I can't do this. because, and we have a word for this, ineffable, and they'll say, see, when I tell you blue and red and yellow, you think I mean blue and red and yellow. Well, yeah, of course I mean blue and red and yellow. And they go on like this, and they'll say, no, I wasn't watching the color. I was in the color. I was part of it. It was part of this technicolor, whatever. And then they'll do the same thing with sounds. They'll say, I heard the best music I ever heard, like in Lord of the Rings or something. That kind of Celtic kind of. No, I'm not doing justice. You think I mean this, and I don't. I mean notes and sounds that I've never mind. It was just wonderful. And that's how the conversation goes. It's impressive to listen to them, even if they don't present an ounce of evidence. It obviously was very real to them, and the experience later, there's usually some life changes.
Bruce, you touched on earlier that a life review seems to commonly be an aspect of an NDE experience. Could you tell us more about what a life review is and how that affects the person who has that experience?
I will, but I'd like to respond to Gary's question first. That, I certainly agree with what he said about the ineffability. Many near-death experiences of this has given metaphors like, they say, it's like trying to draw an odor with a box of crayons. No matter how many crayons you use, you can't capture what an odor is. But in terms of the evidential nature, having grown up as a materialist, I found it very striking that people can describe things accurately from an out-of-body perspective, particularly when the brain is offline. Because if you don't have separation of mind and brain, then you can't have any afterlife. The prerequisite for surviving death is having consciousness survive without the brain. So I'm very impressed by the fact that we have consciousness outside the brain. In terms of that allows afterlife, it doesn't require it, but it allows it. But we do have some phenomena that I do think are evidential. Many people, as Gary mentioned, will see their deceased loved ones in the near-death experience. And these are often easy to dismiss as saying that was wishful thinking, that was expectation. You thought you were dying, you wanted to see your deceased grandmother, so you conjured up her image. But there are a number of cases where somebody sees a deceased person that no one knew had died. And those cannot be dismissed as expectation. Let me give you an example, because sometimes they're very specific. There was a 25-year-old technical writer who had serious pneumonia and was hospitalized with repeated respiratory arrests when he couldn't get his breath. He was hospitalized in his home country in South Africa. And one of his favorite nurses was a young woman about his age who would often flirt with him, as he thought she was. And one day she told him, I'm going to be away for the long weekend, so you'll be having other nurses. He wished her well and said goodbye to her. Shortly after she left, he had another respiratory arrest and he had to be resuscitated. During that period, he had a near-death experience in which he found himself in another realm. He described it as a beautiful pastoral garden. And then to his great surprise, this favorite nurse of his, Anita, came walking towards him. And startled, he said, Anita, what are you doing here? And she said, this is where I am now. I'm staying here, but you have to go back. And I want you to tell my parents that I love them and I'm sorry I wrecked the red MGB. And then she turned and walked away. He was then resuscitated and found himself back in his body with full memory of this experience. And he told the first nurse he saw, who got very upset and went out of the room crying. He later learned that this favorite nurse of his, Anita, had taken the weekend off because her parents were coming to visit for her 21st birthday. And they surprised her with a red MGB. She got very excited, jumped in the car, took off, sped down a hill, lost control, and smashed into a telephone pole, dying instantly, a few hours before his near-death experience. Now, there's no way he could have known that she had died, let alone how she died. And yet, it was accurate. And that strongly suggests to me that something about Anita had survived her death and was able to communicate with the patient.
So he did have a life review, but just a little tiny bit of a life review.
Well, let me come back to Ranae's question about the life review, because this happens in about a quarter of all near-death experiences. And people describe seeing their lives pass before them, which often is accompanied by some type of a moral inventory of what they've done right and what they've done wrong. Most of them don't say they were judged by some other entity. They say, I judged myself, and I felt the consequences of everything I did. And some of them will describe experiencing the events in their past lives, not only through their eyes, but through the eyes of the people they were affecting. And a dramatic example is a fellow named Tom Sawyer, that was his real name, who had an experience in his 30s when a truck he was working under came down and crushed his chest. It fell down on him. And he remembered his entire life. And one event stood out for him in particular. When he was a teenager, a hot-headed, hot-rodding teenager, he was driving his truck down the street, and a drunk man ran out in front of his truck and almost hit him. He stopped the truck, rolled down the window, and being a hot-headed teenager, started shouting at the man. And the man, being drunk, reached his hand in the open car window, in the truck window, and slapped Tom across the face. Well, that was not going to sit well with Tom, so he opened the car door, went out, and started beating the man mercilessly and pounded him repeatedly until he was lying there as a bloody mass in the median. Then he got in his truck and drove away. Well, many years later, when he had his near-death experience, he relived that event through his own eyes and through the eyes of the man he had beaten. And he said, I was in that man's body, watching Tom's face get redder and redder, and hearing the anger in his voice, and then feeling each one of the 32 blows in my face and my chest. And I felt my nose getting bloodied, and I felt my teeth going through my lower lip. And he experienced the whole thing from his perspective and from his victim's perspective. And this has been repeated time after time by near-death experiencers about what they call an empathic life review, where they experience the consequences of their behavior on other people.
Do they see that as kind of a terrifying experience to feel the other person's emotions and feelings?
They usually describe it in more neutral terms, as if this is just a fact of the way it is, that I now appreciate and understand that we're not individuals, we all are interconnected. And what you do to yourself, what you're doing to other people, you're really doing to yourself. And this leads them ultimately to basically the golden rule, that you need to treat other people as you want to be treated yourself. And they say this is for me no longer a goal we should try to achieve. This is for me now a law of how the universe works, that what you do to someone else, you do to yourself.
Do
Gary,
you find, oh, I'm sorry.
Gary, if he'd like to address the life reviews from a spiritual perspective.
Well, it's difficult. I mean, it's spiritual. What I mean is they take it that way, and that's the way they perceive it. I don't think it fits into any kind of, let's say, theology exam, but I think that's totally irrelevant. I think it doesn't have to. I think very many times from a Christian or another viewpoint, we get in our mind what this sort of thing must be like. And sometimes we get a little too rigid, and we think that the way we think of something is the way it's always and only going to happen. And then don't forget, too, that the experience that the person's reporting, they've got no proof for the life review. You just have to take it as their comment and how it affected them, and it seems very real, and it changed their life. I think it doesn't pay in this subject to come with real strict, obsessive kind of categories that tell us this has to be this or that. We're all different. We have different experiences. And so I tried both sides. I try to listen to the person who has the ineffable experience. They're I remember one or two that were just shockingly life-giving and with no evidence. But then I pay more attention to the evidential cases because they're the ones I can, quote unquote, hang my hat on, that I could make some kind of theory about. You have to be careful in any kind, but more data is better than no data when you're trying to categorize these things.
So life reviews have affected the experiencers profoundly, but did that kind of overflow onto their family members? Do you have any data about that?
Well, we do have some data about how near-death experiences affect people who haven't had them. And we find that the family often become profoundly affected by it. We also have data showing that students who learn about near-death experiences become more compassionate and more altruistic. And this has been studied with in several different colleges with college students who have courses in near-death experiences. There was one study in a nursing school, and actually one study done in a high school, in which one of the teachers described her near-death experience, and they spent several weeks talking about near-death experiences. And follow-up studies a year later showed that these students were profoundly affected for the entire year.
Gary, do you know of any instances where somebody was perhaps an atheist and then after their NDE, they changed their mind?
Well, I'm working on an article right now, another article on evidential NDEs, and I don't key on those cases because they don't come with the kind of evidence that I'm looking for. However, yes, just in the last week, I've read a new 2 or 3 of them, and actually, a fellow just sent me one just about 2 days ago, and he said, I was an atheist, he said, and I had this experience, and it couldn't have happened to a worse guy. But he said, I had this, and he said, I'm a changed person. What should I do? What should I look for? What should I, whatever? And of course, a very, very well-known one is by a fellow named Howard Storm, who wrote his book up. His title, My Descent into Death. He was a very rigorous atheist at a state university in another field, not a religious or medical field. And he and his wife were traveling, and he had a very involved, subjective, but very involved near-death experience that came from a case that brought him very, very close to death. And he's one of several who record being in a state that was just absolutely horrible. I mean, when you think of his case, think of zombies or something, being chased by people who want to tear parts of your body off. I mean, it was that kind of thing. And he had no religious training since he was very, very young child. And he wanted to, while he was running and hurting, he was trying to think of something religious, and he couldn't think of anything. And then finally he shouted out the name Jesus, and he said he looked across this gulf and there was a little tiny light. And all of a sudden the light went right up into his face. And this person who, as Bruce said, people describe according to their own backgrounds oftentimes, cultural and religious backgrounds, but he said it was Jesus, but this fellow didn't have any quote unquote Jesus background. And he ended up asking Jesus a bunch of questions and philosophical kind of questions. And he wrote this all up in a book that's had a lot of influence. But you talk about life changes. He went back to his university and tried to live normally and just was not satisfied. So he ended up going to seminary, getting a seminary degree, and spending the next few decades pastoring a church, and recently retired. He and I did a movie taping.
I was going to ask you if that was him.
Well, there's a lot of them now. This was a movie for Netflix, and he and I were 2 of several people being interviewed, and his story always captivates, because with that story, you don't have to have evidence to be moved any more than you can watch, a zombie movie and not be moved. I mean, that's a good example of a subjective case that's very moving, even without data.
Bruce, going back to the scientific side of things, you developed this scale to scientifically consider all the data from the thousands of people who you've been researching who had near-death experiences. And that scale itself was eventually put to the test, and it held up. So can you tell us about that?
Sure. I did this in the early 1980s when there were a number of researchers at different institutions trying to study NDEs. And we wanted to try to make sure they were all studying the same thing. You know, some people who are interested in brain chemistry would look at consciousness. Was it vivid? Was it confused? Other people who are interested in the philosophical or the religious perspective may look at, did they see God, and so forth. And you know, others who are interested in the after effects may say, were they changed afterwards? And they wouldn't all be looking at asking the same questions. So we did a study to try to collect the most common and typical features of a near-death experience, and eventually came up with 16 questions that would outline what is the core near-death experience. And we developed a scale out of this to identify and then quantify the depth of a near-death experience. Now, this is very helpful for comparing experiences across different researchers and deciding what should or shouldn't be included in the research. It's not really helpful in dealing with one individual person who's had an NDE, because a person can have a very low score on this scale and yet be profoundly changed by the experience. So we can't say to them, you didn't have an NDE because you didn't score high on the scale. They were obviously profoundly affected by it.
I have a question, and when you're talking to people who are relaying their experience, do you ever like hook them up and see what kind of brain waves they're having? I think as I recall from my schooling, when you're thinking, you have beta waves, and when you're dreaming, you have theta waves. And I'm just wondering what kind of brain waves they had, and if you tested that.
Yeah, I have not, but other people have. Mario Beauregard, who was a neuroscientist at the University of Montreal at the time, brought near-death experiencers into his lab and did various types of brain imaging with them as they tried to recall and relive the NDE. There were all sorts of theories about what part of the brain is involved in the near-death experience, most focusing on the right temporal lobe. And what he found was that there was no one area, that all parts of the brain were involved, which kind of makes sense when you think that the NDE includes vivid thinking, vivid perceptions, strong emotions. So of course, the whole brain is going to be involved. There are other ways of trying to differentiate whether this is a real event or just a fantasy. There are scales that have been developed to differentiate memories of real events from memories of imagined events. And this was developed originally to study children who claim to remember childhood abuse. And we wanted to know whether this was real or a fantasy. So they developed this scale. A psychologist named Marcia Johnson developed this scale. And we gave that scale to near-death experiencers. And we had them rate their NDE and then another vivid experience from their life around the same time, and then an imagined experience from that time. And what we found was that the near-death experience was remembered like the real events and not like the fantasies. In fact, they scored higher as in reality than the real events were. Now that study was replicated by two other teams in Belgium and in Italy. And the Italian team also measured brainwaves as the people who were remembering the NDE. And what they reported was, again, that the brainwaves looked like memories of real events being processed, not memories of dreams or fantasies being processed.
So some of the things they were doing were like tracking their eye movements, and you know that thing about if you're right-handed and you remember something, you look up to the right, and if you fantasize up to the left or whatever.
Yeah, we haven't done that. We've looked at brainwaves though.
Okay.
Bruce, what's the scientifically held model, or the scientifically accepted model currently of what happens when we die, and do NDEs challenge that model?
Well, it's a difficult question because we used to think death was an event. You're living now, your heart stops, you're dead. And now we're appreciating that it's not a single event, but a process. Sam Parnia, who's a critical care physician at NYU, has done the most writing about this, that there's a gradual process where different types of cells in the body differ in how quickly they stop functioning. So death can take a long period of time based on what you're using as your criterion. If we look at what happens during cardiac arrest, which is the most studied way of coming close to death or dying, we find that when the heart stops pumping, you no longer get blood going to the brain carrying nutrients and oxygen. And within 4 or 5 seconds of the heart stopping, the brain waves start to diminish. And within about 20 seconds, they go totally flat, which means no measurable electrical activity in the brain. And at that point, presumably there's no consciousness. And yet people who have this experience describe the most vivid consciousness of their lives.
So earlier, you guys were telling us that it's difficult for people to talk about their NDE. Can both of you expound more on why people have such difficulties in talking about it? What are they afraid of?
Well, it was much more of a problem back in the 80s and 90s when fewer people heard about near-death experiences, and many experiences were afraid they would be told, "You're crazy. You're just imagining this. It's just the drugs you were given. If you keep talking about this, we'll refer you to a psychiatrist." They were also afraid that people would ridicule them for this, or that people would, on the other hand, put them on a pedestal and think they're supposed to be saints now that they had this spiritual experience. And many experiences just say that it was too personal to share. It's meant for me alone, and I can't really explain it to you. You know, there are some near-death experiencers that I met 30, 40 years ago who told me about what happened to them. And then a couple of years later, they said, "Well, now that I know I can trust you with information like this, let me tell you what really happened." And then a few years later, they'd say, "Well, now let me tell you what really happened." And I'm sure I haven't heard the whole story from these people yet.
Gary, are there any instances of what you would think might have been a near-death experience in Scripture?
Well, people who do this, starting with, like I said, back to Raymond Moody and others, they'll point to things like where Paul says, I know a man. Now he talks like it's somebody else, but then he tells you it's himself. And he said so many years ago when he tells the date, and he said, whether out of the body, he repeats this phrase twice, whether out of the body or in the body, I know not which, and I was caught away to another realm and saw things that it's unlawful for a man to utter. And when New Testament scholars have looked at that, they'll say that the years period that he gives coincides very possibly, that's all they can say, possibly to an event he had where he was stoned and left for dead. His disciples came to bury him and found out that he was alive, but they came to bury him. And so Paul himself seems to have described a near-death experience. You think of the case of Stephen in the New Testament, where he has a pre-death experience where he said he saw a vision of Jesus just as these stones, he was stoned and he died. But he called out and said, I saw Jesus just before he died. And then you've got a parable, a story where Jesus talks about a man who did die and he was carried by angels to Abraham's bosom. Now that's an interesting discussion, that angels took him. Was it a tunnel? Was it a dark space? Who knows? But in the story, he was carried to Abraham by angels, and he remained there. Whereas in a number of the stories that we read all the time, sometimes two people go or one person by themselves, and they're very frequently told, you've got to go back. It's not your time. So you've got a couple there before the fact, and you've got that parable, which isn't a true story per se. It's a story where the person remained. So that much is typical.
Bruce, could you tell us, some scientists think that these NDEs can be caused by electrical activity in the brain or a dream state or chemical changes in the brain. Why don't any of these ideas seem to hold up?
Well, there have been a number of these hypotheses based on physiological changes, and they all make sense from a theoretical perspective. But when we actually collect data to try to test these hypotheses, the data invariably contradict them. For example, the first one, and the most common one, was that there's lack of oxygen to the brain. But But we actually tested that in a number of places now. There's studies done both here in this country and in the UK, where they've actually measured the blood levels in people when they're in a near-death state. And we found that those who report near-death experiences actually have more oxygen to the brain than people who don't have NDEs. And same way with people who are given drugs. They said it was drugs given to people as they're in a near-death state. And we find that the more drugs people are given, the less likely they are to report a near-death experience. People have claimed that types of electrical activity in the brain are causing NDEs. And we find, again, that when people have their brains ceasing, when they have flat EEGs, they tend to report very elaborate near-death experiences. And this is also supported by other evidence. For example, we've done in the past decade neuroimaging of people having psychedelic drug trips that have spiritual elements. We used to think that the way these drugs work is by stimulating the brain to hallucinate. But what these studies show consistently is that the more elaborate spiritual experiences taken with these drugs occur with a decrease in the amount of electrical activity in the brain, not an increase. So there seems to be consistent evidence that these models we put forth to try to explain away NDEs just do not hold water. They don't fit the data.
I think our listeners would never forgive us if we didn't ask you if each of you could tell us the most astounding account you've heard.
Well, I'm going to duck this one because as far as I'm concerned, every account is astounding. And certainly some of them are just mind-blowing. When people report very unexpected things happening around the body that they report accurately, or when they report meeting deceased people who were not known to be dead, those just are very impressive to me. But as a psychiatrist, what I find most interesting are the profound changes in people's lives after an NDE. People don't turn their lives around because of a hallucination or a dream. And yet I've talked to people in their 90s who had the experience when they were teenagers and said, it's like it happened yesterday. I've never been the same. And I've known people who were career military officers who had NDEs and found that they could not continue to shoot. It's just unthinkable to them to kill somebody after this. And they just had to completely turn their lives around. I've talked to cutthroat businessmen who said that after my NDE, competition makes no sense anymore. And they go back to college and train to be a teacher or a healthcare worker. They just can't continue their old lifestyle. And, I'm in the business of trying to help people change their lives. I know how hard it can be. And here you have experience that takes a fraction of a second or a few seconds, and it totally transforms people's attitudes, beliefs, values, and behavior. And that to me is the most astounding part of the NDE.
For me, I know an essay I did a few years ago on evidential NDEs. I divided data into 5 categories. Reports, what they all have in common are corroborated reports. But you have corroboration inside a room, corroboration outside a room, which could be 2 floors away in a waiting room, or it could be 2 miles away in your house, so a distance away. It could be, these are rare to me, but you have NDE cases in blind persons who are blind from birth or almost immediately after birth. And sometimes I'll say the only time they saw anything was during the NDE, and now they go back to being blind. But what they reported during that time was evidential. Another one is there are very few shared NDEs where a healthy person witnesses the same data. In one case, a sister and a brother, and she's sent back, but he's kept because he died in the accident. And she reports a very interesting event from the family that nobody knew at that time. And then the 5th category, I would say, this one that I think Bruce has written so much on, the cases that have been mentioned several times here, where you meet a deceased loved one who sometimes has been dead for years, but they give that kind of evidence, like this South African story where nobody knew the person had just died. And I would answer the question sort of like he did. I would take this track. People ask me that all the time, which is the most convincing case? And I would say, if you want the data, if that's the kind you want, because not everybody wants hard data, but if you want the data, it depends on what kind you want. Because I know skeptics, unbelievers, who think the evidence in the room is the best because, you know, there are people right there and they can get interviews. But another skeptic will say that that's a bunch of baloney. Data from away from the room is the best. And then others might say, no, I like that South African story because that person is demonstrably dead. If that came from the mind of the woman who just died in the car accident, she's not near death. She's dead. It's the near death person that reports it. So I think it's what's your cup of tea, you know, what you're looking for, because there are hundreds of evidence near death cases. Now, I outlined 300 of them in this other publication, and I'm doing it again now. And it really is different strokes for different folks. It's what you want. I mean, some of the cases are so strange. One of them, just this isn't a highly evidential one, but it's an interesting one. The medical doctor was talking to the person in the room after the surgery, and the patient was getting a little bit bothered. And the medical doctor said, I'm sorry, that's not going to work. We tested that. And the patient said, you did not test it. And he said, we did test it. The machine is in the room. And the person said, go check and tell me what you find. And he went down the hall and came back and very sheepishly said, you're right. The machine was there and it was unplugged and nobody caught it. So just some of those, that's not extremely evidential, but it's extremely striking. I think it's whatever you want. You can find a case that has data, or if you say, I'm not interested in data, I just want to, like Howard Storm's story, I just want this heartwarming story that started out horribly and ended up well, you can find anything.
Do you think, since we think the brain and the mind are two different things now, do you think the mind is possibly the soul? Sorry.
From a philosophical viewpoint, I wouldn't say anything has to be a soul, but I do think the soul is not the brain, and it's more likely that the brain works through, the mind works through the brain rather than the brain producing the mind. And so I do think that what we call mind, if somebody wants to call it a soul, I'm fine with that. I wouldn't parse my verbs like that. I wouldn't do definitions like that. But if you want to call the immaterial part that seems to go on after a flat brain, flat heart, measurable state, and I always add measurable. I remember a neurologist, surgeon, tell me one time, it's fine if you use that language, but just say measurable. And so that's what I say, measurable. If you want to go beyond that point, that's fine. And if you want to say, well, then in my soul, I was doing this, I'll never stop them or correct them. They're just using their word for the immaterial thing that they think survives, and I'm totally fine with that.
Bruce, are you in agreement with Gary's answer?
Oh, yes, definitely. I don't care, again, what you call it, but there seems to be evidence that some part of us that thinks and feels and perceives persists after the brain has stopped. And you can call it mind, you can call it soul, you can call it X, I don't care.
That's right. That's right.
Do you guys think there are any false conclusions drawn from the NDE experiences?
I think there's all kinds of false conclusions because many of them have to do with, and we refer to this, they have to do with cultural or religious ideas, which are themselves not grounded, but the person is feeding back through their grid. And you just have to listen and say, oh, really? Yeah. Is that true? Wow, that's great. And just listen. I mean, I remember one study, a comparison of Hindus with Western culture, largely Hindu culture versus largely Christian. And in the Hindu reports, females were very rarely reported as the persons that they said they met afterwards. But in the Western case, there were more females reported than males. That's the kind of cultural thing that you would say, oh, that's because of the difference between Hindu culture, and I think the other one was British or American. Those are cultural differences. So we just have to allow for that. And again, that's one reason I'd rather narrow down on the evidence. But at the same time, I am moved by people who have nothing but a subjective experience with no data. They're very moving.
Bruce, you were talking about people changing in an instant. Can you talk a little bit about people who are suicidal And they have an NDE?
Sure, sure. One of the most profound after effects of a near-death experience is the loss of a fear of death. And when I first realized that, that kind of scared me as a psychiatrist, because I know that being afraid of dying or afraid of what happens after death stops many people from trying to kill themselves. So I did a study of people who made suicide attempts and compared those who had an NDE as a result of the attempt and those who didn't. And what we found was that those who had an NDE were much less suicidal afterwards than those who didn't have NDEs. And psychologist Kenneth Ring has replicated this in another sample. When I ask near-death experiencers about this, they say that I still have the same problems that made me suicidal before, but now I see them in a different perspective. Now I realized I'm more than just this bag of skin with these particular problems. I'm part of something much greater than myself. And those problems I thought were important were things that I thought you need to escape from are now part of something that has meaning and purpose to it. And I'm supposed to learn from those and grow from them, not run away from them. They say that even though I'm no longer afraid of death, that means I'm no longer afraid of life. I'm not afraid to live more fully and take chances because I'm not afraid of losing it. So I can enjoy life much more now than I did before.
Speaking of it changing people's lives, how have the study of NDEs changed both of you guys, Bruce and Gary?
Well, I started off without any type of religious or spiritual tradition, and it just was not a part of my life. And I don't think I can escape that any longer. I feel like there is definitely some spiritual aspect to who we are and to the universe in general. I don't have great labels to put on that because I don't have the tradition to interpret it with. But I realize that the physical world is not all of what we are, and in fact is not the most important part of what we are. Also, being a scientist, I went into this thinking that science has all the answers, and we're going to get all the answers sooner or later. And over the decades of doing this research, I've come to realize there are a lot of questions we're not going to find scientific answers for. And I've become very comfortable with not having all the answers. And that's made my life a lot easier too.
Yeah, in my case, we started, and for me, talking about that case of losing the closest person in my life when I was 8 years old, and having growing up in my early years with being afraid of death, because for her, that's what took the number one person in my life away from me. Near-death experiences have done very much what Bruce described earlier with the studies that have been done with either those who've listened to the NDEs or those who've heard the teachers talk in class. Those cases, they've had a very profound effect on me. I think they're very comforting. I think they're very peaceful. I think you're going to have to come up with your own worldview to describe them. I think you're going to have to do some philosophy, some philosophical categories, and hopefully you're going to have some data for what you're going with. But just the experience themselves, they can be very, very helpful. These stories about your question about suicide is very influential. If it can have that kind of effect on people, and people's lives can be changed for the rest of their life. And many of the studies, as Bruce mentioned, I mean, some of them, everybody who participated lost their fear of death. And other times it's just fairly high numbers. That alone is profound, given that is supposedly the worst fear we'll ever face. So these are profound effects.
Bruce, your book came out this week.
Yes.
And so can you tell us where people can get your book after?
Well, you can get it any place books are sold. Amazon, Barnes & Noble, Indie Books, any of those sources will have it. On my website, which is www.brucegreysson.com, includes links to all these sites where you can read about the book, order it, and read more about near-death experiences as well.
And Gary, you've written so many books too. Where can people get your books?
Well, I also have a website. I do not sell anything. And like Bruce, my website is my name. Only it's G Habermas. I'm sorry, I'm giving you my email. it's GaryHabermas.com. And I have a YouTube channel too, and there's a lot of near-death on both these. And again, working on a new publication right now that should be out in a while on evidential near-death cases to augment one I did a few years ago for another academic publisher. So, like I said, it's had a big effect too.
Well, Bruce Greyson, MD, the Professor Emeritus of Psychiatry and Neurobehavioral Sciences at the University of Virginia, who has studied near-death experiences for more than 45 years. As he said, you can get his book After from Amazon or Barnes & Nobles or wherever where books are sold. And Dr. Habermas, the Distinguished Professor of Philosophy and Theology at Liberty University, in addition to being a recognized expert on near-death experiences, he's a worldwide renowned expert on the historical evidence of the resurrection of Jesus Christ. And that subject, he's going to discuss with us on Easter Day. It'll be aired on April 4th. We want to thank both of you, gentlemen. What a fascinating conversation we've had with you today.
Thank you, Dan. It's been a pleasure to talk with you.
Thank you, Deanna and Renee. Been a great time. Thanks.
Thank you.
Great sharing with you too, Bruce.
Nice to see you again, Gary.